Drinking water and cutting back on salt are standard recommendations. That advice is correct, but overlooks the recovery window that happens while you sleep. Your kidneys perform some of their most important maintenance work overnight, specifically in the hours after your blood pressure drops and your filtering naturally slows down. What you eat in that final hour before bed either assists that recovery or forces the kidneys to work through their rest period. Swapping nighttime snacks for fresh fruit seems like a logical choice, but for a specific group of people, even healthy fruits can become a biological liability if the filters are no longer able to process certain nutrients. Because kidney decline produces no pain, a third of your filtering power can be gone before a routine blood test ever picks it up. This makes your evening food choices just as critical as your daytime hydration. This process is called nighttime dipping. In a healthy body, blood pressure naturally drops by 10 to 20% during sleep. This dip provides the required resting state for the kidneys, allowing the filters to recover from the day's constant pressure. Inside each kidney are about 1 million tiny filters called nephrons. These are the engines that pull waste out of your blood, and unlike your liver, these filters do not grow back once they are lost. When blood pressure fails to dip, it grinds against those tiny vessels like water hammering through a hose. Over years, that constant pressure scars the filters shut. This mechanical stress is compounded by oxidative stress, a slow internal rusting that damages the cells of the kidney filters. The goal of an evening fruit swap is simple: facilitate that nighttime pressure dip and neutralize the oxidative rusting before the night shift begins. To assist that nighttime dip, we look first at baseline protectors, fruits that are safe for almost everyone. Blueberries contain pigments called anthocyanins. These are powerful antioxidants that directly quench the oxidative stress that scars kidney filters. Blueberries are a top choice because they deliver these antioxidants while remaining low in both sugar and potassium, making them gentle on filters that are already under strain. Apples protect the kidneys through the gut. Their pectin feeds beneficial bacteria, sending less inflammation into the bloodstream, reducing kidney stress. Most of an apple's protective quercetin is concentrated in the skin. Peeling it removes the primary compound responsible for protecting your blood vessels. To keep blood sugar stable before sleep, stick to a modest portion, roughly half a cup of berries or 1 medium apple. These baseline protectors provide an anti-inflammatory benefit with very little risk, helping to cool the system before your body settles in for the night. Next are the cleanup fruits, which address specific waste products that can damage kidney tissue. Tart cherries help lower blood levels of uric acid. This reduces the risk of crystal formation, which is the primary cause of gout and kidney stones. They also contain natural melatonin. This helps you transition into a deeper sleep, which is required for your blood pressure to take its full nighttime dip. Cranberries contain a specific compound that makes it physically harder for bacteria to grab onto the lining of the urinary tract, preventing infections from reaching the kidneys. The trade-off for these fruits is the sugar content. You must use the unsweetened, tart versions, not sugary cocktails or juices, which can spike your blood sugar. While these fruits provide excellent structural protection, adding processed sugar undoes the work they do for your filters. Finally, we have to address citrus. This is the most controversial group on the list because the benefits and risks are two-sided. Citrus fruits provide citrate, which binds to calcium in the urine and prevents it from forming into stones. For healthy kidneys, this is a vital defense. The trade-off is that citrus has a high potassium content. Healthy kidneys clear extra potassium easily, and the mineral actually helps lower blood pressure. But failing filters lose the ability to clear this mineral. Potassium begins backing up in the blood, reaching dangerous levels. The medical rule: if you have advanced kidney disease or take potassium-affecting medications, you must strictly avoid high-potassium fruits in the evening. The safety of a food is relative to the health of the organ processing it. What protects a healthy kidney can be a toxin to a failing one. To protect your filters, you must choose a nighttime fruit path that matches your current kidney status. Path A is for those with healthy kidneys focused on prevention. In this case, all the fruits mentioned are safe evening options. For this group, a bedtime kidney tonic, blending blueberries, strawberries, and kefir, supports the gut-kidney axis and provides the melatonin needed for the nighttime dip. Path B is the early strain cohort, people with slightly elevated creatinine or borderline function. This group must prioritize low potassium options like blueberries or apples and move citrus consumption exclusively to the daytime to avoid overloading the filters at night. Path C includes those with advanced kidney disease or anyone on potassium-affecting blood pressure medications. If you are in Path C, you should only add these fruits with your doctor's specific blessing, as your potassium limits must be strictly managed. Replacing an inflammatory nighttime snack with the safe fruit for your specific cohort is a practical daily step you can take to support your kidneys during their recovery window. You cannot rely on how you feel to determine which path you are on, because kidneys fail quietly. To see which path applies to you, look at your recent blood work for two specific metrics, your eGFR and your potassium levels. Knowing these two numbers allows you to stop guessing and start using targeted nutrition to protect your filters. Real kidney protection is about understanding your own data and giving your filters exactly what they need during their critical night shift.